How to understand your colorectal cancer pathology report. Imagine opening a detailed report that holds the key to understanding your diagnosis. A colorectal cancer pathology report is exactly that, a document created by a pathologist after examining tissue from your colon or rectum. This tissue is usually obtained through a biopsy or during surgery. The report provides vital details about the cancer's type, how aggressive it is, and how far it has spread, all of which help your medical team decide on the best treatment plan. The first part of the report includes demographic and specimen information. This means your name, birth date, and details about the tissue sample, like whether it was from a biopsy or surgical removal, and exactly where in your colon or rectum the tissue came from. Next, the gross description describes what the tissue looks like to the naked. The pathologist notes its size, weight, color, and any visible abnormalities, giving a basic overview of the sample. Then comes the microscopic description, which is more detailed. Under the microscope, the pathologist examines the cancer cells, noting their appearance and arrangement. Most colorectal cancers are adenocarcinomas, originating from glandular cells lining the colon or rectum. The report might also mention if polyps were removed, especially since some types of polyps have a higher chance of turning into cancer. A key part of the report is the histologic grade, which shows how much the cancer cells differ from normal cells. Well-differentiated cells look more like normal cells and tend to grow slowly. Moderately differentiated cells are somewhat abnormal, while poorly differentiated or high-grade cells look very different and tend to grow and spread faster. This grading helps predict how aggressive the cancer might be and influences treatment choices. The report also describes the tumor size and how deeply it has invaded the layers of the colon or rectum wall. This is known as the tumor stage or T stage. Larger tumors or those that invade deeper layers are usually more advanced. The number of lymph nodes examined and how many contain cancer cells are also included. If cancer has spread to lymph nodes, it often indicates a higher stage and can change the treatment approach. Margins are another important detail. They tell whether cancer cells are present at the edges of the removed tissue. Clear or negative margins mean the cancer was likely completely removed, while positive margins suggest some cancer might still be present. The report also notes if cancer cells have entered blood vessels or lymphatic vessels, a sign called lymphovascular invasion, which can increase the risk of spread. Additional factors might include how quickly the cancer cells are dividing, known as the mitotic rate, and any molecular or immunohistochemical markers that can influence prognosis or targeted therapy options. Finally, the pathologist provides a summary diagnosis and may include comments to clarify or emphasize certain findings. Understanding your pathology report is essential because it helps determine the stage of your cancer, guides treatment options, and provides insight into your outlook. Always discuss your report with your healthcare team, especially your oncologist or surgeon. They can explain what each part means in the context of your overall health and help you understand your diagnosis. Remember, medical reports use specialized language, so don't hesitate to ask questions or seek clarification. Your healthcare team is there to support you and ensure you have the information you need to make informed decisions about your care.